Hi, everyone. It's Mike Sovis, and I wanted to take time to go over a new process that we're going to have for workman's comp. The template's going to remain the same, but there's going to be new items that are now placed into this template to attempt to make this automated. Joy DeLong has worked with Robert, and they have formulated a process where we're going to put in all that information that's on the DWC right into the chart. This would entail that we would no longer need to come down here and go to the web mode and make a separate DWC form. Before I start this and you begin to watch it, I would recommend that you go get a copy of a DWC so you can follow along, because this is going to confuse you because you're not going to have this item in your hand. So please go get one of those. All right, the first part of this is going to be the area that workman's comp triage person would put this workman's comp patient into. So they're going to hit that area there. Anytime you see S, means this is structured data. It means you have to complete it in order to move on to the next section. So we're going to hit this. All right, so kind of it's self-explanatory. These are going to be drop-down menus. In this case, this is a follow-up case, all right? And this question has to be answered because it will then lead to whose signature and so forth is on this. It's going to ask if this is the initial visit was with this physician. And I'm going to put no, because I originally saw the patient and now Roseman is actually going to see this patient. The date of the accident is going to stay. All the stuff from the previous visit is going to be in here, except if a person states, well, now my back hurts. Actually, I put that in there. Let's say the person said, I fell, I hurt my shoulder, my wrist. Now you have to add back, okay? Here, the employer name. If you were to drop this, it's going to have a search, and that's empty right now. But if you want, we can start adding custom names, Triumph, Waste Management, and put them here. So then they're just an easy click. Once they're in here, you just come over and click. Same thing with job title. I don't know that we're going to have so many different job titles from places. I don't know that it would be imperative that we put a custom list in. In this case, we can put driver, refuge, attendant, something like that. All right. So now this part is done. And we're going to go out of this. I'm going to click off. This area here is still in the triage note. So this would have to be answered from the actual note itself. It's not going to be in the drop down. So if I click one of those, you're going to see it's just the standard template, and you're going to need to put that information in there. All right. Very important, as with all of our patients, every patient that is seen at Helix must have their medications verified. This button must be clicked in order for us to get credit with MIPS. And if a patient hasn't been seen, and let's say they were seen last week, please don't say your meds are the same, correct? And they'll say yes. Please ask them the coenzyme or lisinopril, and make sure, because we have had cases that have been legal cases where patients state we said they were on these meds and they were not on the meds. So let's make sure we verify those. I'm going to click that. Go to the next section. Again, very important, we verify past major medical history. This patient doesn't have any. Very important, allergies. They don't have any medications. And that automatically checks. And then if there's any surgical, we're going to put that in there. All right. Not so concerned about family history on these. All right. So here's where there's huge changes. Again, this is going to be a steep learning curve, But I think once we get this completed, it will be very easy for us to more rapidly complete these DWCs. So let's go ahead and click that. All of this is clinical information that is structured. So if you have the DWC form in your hand, as you can hear, I've got mine in my hand because it's important that I have it. All DWCs require, so this should always be yes. So let's click the very first item. And that's question number 9. So let's say this patient was seen by us and there are no changes. Those are our patients that we love. They're coming back for a wound check. We click, we just check no change number 9. Then we go to section 2. We check the first one, 14 key issue. The next section, we can say attendant care. We washed and cleaned the wound and put a Band-Aid on it, and then moving on. But in this case, yeah, there's going to be some changes. Let's pretend that this person came back with their MRI, and we need to follow that up because they came back and it's a positive MRI for a humeral head fracture. So if it's a clear-cut case and it's a true fracture, then it's going to be work-related. Let's say it was nothing but arthritis. There was nothing, it was tendinosis, arthritis. That could be undetermined. But in this case, we're going to put it's work-related. We're going to have here where I was going to pause this. I thought actually my dogs were going to start barking, but they didn't. Okay. So this patient has been determined to have, that's number 11, objective findings. So in this case, we can hit yes because we have a positive MRI. And over here, we can type in humeral head fracture. All right. Is there any pre-existing conditions? Now, this patient said she had knee surgery, but we're going to hit no because it was fractured. Now, let's again go back up to the top and say it's just arthritis and tendinosis. We can put in this one undetermined. Okay. Doesn't mean we're not going to get paid if you put the word undetermined. Objective medical findings. We can put, this is where we state if there was a pre-existing condition and so forth, and that's going to be a no. Any comorbidities, if a patient is morbidly obese and their knees hurt because they have to walk too far, that could be a comorbidity. A patient is on blood thinners and they have a sprain or a strain somewhere. We want to put them on anti-inflammatories. Again, you could put it as a comorbidity because you have to think through that process, what you're going to put them on for a medication. In this case, we're going to hit no. And giving your responses to those items, these are the ones that we hit yes, 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 essentially stating, does the injury make sense to, she fell turning a corner on a wet floor, landed on her shoulder or put her arm out. So we're hitting yes, yes, yes on those. And again, if you're looking at your form, you're going to better understand this. So we're going to hit OK. All right. Now this is the next section. This is the classification. It's 14, 15, and 16 on your form. And if this person has a key issue, yes, they have a broken shoulder, blah, blah, blah. Let's say the person, like I give an example, I have a patient that complained he worked at Walmart. He worked at a smaller Walmart. He had to go collect carts, and now he works at a bigger one, and he complains the arches in his feet hurt, and he can't walk anymore. Well, this is going to probably be a level 2. He's deconditioned. And versus being a level 1. So please take the time to read through these so that they correlate with what your notes state. All right, so your treatment plan. I know you saw me check that box. If you just open this up, it's the same as checking the box there. So we are going to have clinical services. So again, if you go to your form, you're going to go, this is the part where we refer a patient to another orthopedic, we add medications. So all these with the red dots here, asterisks, you're going to have to answer those or you won't be able to move on. So I'm going to transfer care, and I'm going to do over here, ortho surgery, add that in. There's going to be no new diagnostics, no physical medicine, it's not applicable. Pharmacy, I'm not giving them any extra meds. They're already in a sling. I'm not going to do anything. So again, you're going to have to go in and hit if it's not applicable. All right. Now I'm going to hit OK, and that moves on. This is the restrictions and limitations. Again, one good thing about this, I'm going to click the bottom one. Once this goes in, which makes this very nice for all of us providers, let's say I saw the patient and I said no lifting with the left arm, no pulling, none, all of that, and it's in here. Now Roseman's seeing the patient. He doesn't need to look back because this is automatically going to be there from what I put, which is going to save us so much time, because many times I know that you take care of patients and the patient goes, well, that's not what the last person did. So that's where this is going to be extremely helpful for us. Climb, we're going to put an issue for climbing, lifting, pushing, pulling, and grasping. All right. We'll hit OK. Okay, see, it's not letting us go through. I hit that OK at the bottom. So climb, frequency and duration. All right, we're going to hit over here. So sorry. Cancel, I'm making. All right, so frequency and duration, you got to come over here on this part, and we're going to hit none. We don't want them climbing with the broken arm. All right, grasping, you can either put frequency and duration or range of motion and position. And it's going to be easier if I go along here and just do this. I'm going to give you an example when we're going to do load. So that's lifting, and the same thing here, load, and we'll do load. All right. Now I'm going to come back up here and hit avoid. All right. And we're going to come over here. I'm going to hit none. Now this one's going to have a load. So less than or greater than 5 pounds. So I'm going to put less than 5 pounds. All right. If I wanted none, I needed that on the other one. And over here, I'm going to put less than 5 pounds. This one, I'm going to put less than 5 pounds. And that's it. I'm going to hit OK. The very last one, medical improvement, that's going to be, are they coming back to see us? Next scheduled appointment, we're going to put this in here. I'm just going to put next week because we need a next one. And I'm going to type under the notes with ortho surgery. And also in this form, wait, let me hit this one here. I see, I already lost myself. Have they met maximum medical improvement? This needs to be answered up here. No. See, that's where I had missed that. So I skipped to the bottom too fast. So this is going to be none. So obviously we can't give an impairment rating, and we know that everyone in our office can only give us 0. If you're going to get a number, you need to be a specialist. because that has to be testified in court of your specialty and your history of assessing a percentage. And so that would be a hand surgeon, an orthopedic surgeon, a plastic surgeon, a psychiatrist, so forth. Those are the only people that are able to show an impairment rating. And if there is a residual dysfunction, you don't really need to answer that because we're not Maximum Medical and we're transferring care. We can go on ahead and hit OK. Now let's go to the assessments. Humeral head fracture. All right. And we're going to hit subsequent, closed, left, with non-union. We're going to make that. All right. Now, one thing about this assessment, just know that that's going to go right onto the DWC, back into the number 12, the diagnoses. All right. So this way our note will match our DWC. That's where we've had a lot of problems in the past. It's very important that we put in left or right. We cannot have unspecified or the claim gets rejected. And then our accounting department has to call back and speak to providers to go back and change the note. Here you can use the EM coder, accept. This is the charge that care is being done by a service provider at urgent care for the workman's comp, and then obviously our charge there. And this is, we'll just type with ortho surgery. All right, and we'll hit done. Yes. All right. Click this. And that is going to be it. Any questions, please send an email to me at msovis@helixcares.com.